guest. Today is September 2nd, and I'm pretty positive that you guys are going to like our guest today. But first, of course, we'll start with the stats lead.
PAWSitive?
PAWSitive.
Okay. So yeah, today we are doing a little better. We were down to 18. We had 2 more come in. We're at 20. Our inpatient census and the outpatient testing, I think our 7-day rolling average is still in the mid-30s. So again, worried about labor day. I'll talk about that again in a minute. But let's get to first our special guest we have today. We have some people from our volunteer crew. They are led by Georgia Story, who is over our government and community relations. And the volunteers report up to Georgia. So Georgia, you want to tell us a little bit about your volunteer team and what they do?
Sure, thanks Lee. We love our volunteers at Singing River Health System. We've had volunteers here almost as long as we've had our hospital. They are part of our family and they make us better. So we've kind of taken a little break during the pandemic, but we've really been pleased to welcome a few of them back because they really are just so integral to everything that we do. They bring a warmth and a level of hospitality that we just don't have without them. So I've brought you guys today, Miss Carol and Justin, 2 of our longtime superstar volunteers who can tell you a little bit more about what they do.
Hi. The area that we work in is surgery waiting, which encompasses the cardiac cath lab, the treatment clinic, the surgery cases, and we help the nurses, the staff, of course the patients, and their guests. We're here to make their jobs a lot easier and mostly to give back to our community. There are 6 of us that are working, and this is Justin. He's one of our most important volunteers.
Hi, I'm Justin Fisher. I'm a volunteer at Ocean Springs Hospital. I like to help people, escort people when they need to go to different areas of the hospital.
If it wasn't for you guys, nobody would know where to go,
That's
right,
the
Justin?
That's right.
What do you like most about being a volunteer?
Meet new people and help people where they need to go. And
Get them where they need to go. What about you, Miss Carol?
Well, I like giving back to the community. I've lived in Ocean Springs ever since I got out active duty Air Force, and I worked here as an X-ray tech back in the 70s, and it was a great place to work. And when I retired, I said I wanted to go back and give back to the community. So that's the biggest reason why.
And
She also has a special superpower.
that's what we know. We couldn't do without you.
keeps
Tell
this
us
place
about
rolling.
your superpower.
What's your
My
superpower?
superpower is I fix the wheelchairs.
Yes.
So
And you do a great job of that. If it
Yes.
wasn't for you, we wouldn't know what to do.
I enjoy it.
Yeah.
I really enjoy it. So.
That's awesome.
Thank you for continuing our mission through all this. And we're also very excited that our PAWS program was invited back last week. They took a little hiatus thanks to COVID, but now they're here to help support our staff and the guests that do come in. So this is Jennifer Taylor. She does double duty. She works in compliance, but also she's the leader of our PAWS program. So tell us a little bit about why you're back here today.
Thank you. We are so thrilled to be back. First of all, let me say that. Our PAWS program is almost 10 years old. In October, we'll celebrate our 10th anniversary. And that's 10 years of bringing therapy dogs, registered therapy dogs, to visit with our patients and our staff. Our staff gets as much out of it as our patients do. We are cleared to come back now for staff, and our plan going forward is to kind of alternate between the 2 hospitals every Friday and do some pet therapy for the staff whenever we can, and whatever events we have that we can join in.
Nothing makes people happier than seeing the PAWS people come through, that's for sure.
Right, and this is a team that is very committed to the health of our community. We have Casey Arnold. She is at the Diabetes Center here in Ocean Springs, and also Miss Carla. She's a veteran here of Singing River. You know, what are you guys excited about, or how has your experience been with the staff now that you're back?
We've been back, the first time was on Friday, and it was just so exciting to have so many people back with their the employees coming down, and getting the dogs went crazy because they haven't been in the environment in a while.
Right.
So it was really exciting to see their reactions, and they love seeing the volunteers. Quincy goes nuts every time he comes in the hospital. So
They miss their friends.
they know who gives treats. That's what it is. They know who gives
You
treats.
guys
So.
make a great team.
Yeah, it's really fun.
Well, in order to have our volunteers continue to spread joy and comfort to our guests and also our staff, we really need you guys to stay focused this Labor Day weekend. I know we put out a post today. You
Yes.
can find it right below this one, or I think I actually pinned it to the very top, where we actually have the numbers that show just how much holiday weekends have impacted our case numbers as well as deaths.
Put our graph out there. We've got a graph that shows that after Memorial Day and after the 4th of July, about 2.5 weeks after that, we had a spike in cases. And about 2 weeks after that, we unfortunately had a spike in
This
deaths.
is the way.
And there's been 59 deaths since the end of March here in our community that have been caused by COVID. And so our concern is with Labor Day, people are going to get together in their homes, let their guard down, have gatherings, and hug each other. As we say, you love them, don't hug them, because people are going to get together and do that, and we're going to have a little spike. Not a tidal wave, but we think there'll be another wave. That's preventable, that's avoidable. We would like to keep things on the track they're on now, where the volunteers can be back in here, where the PAWS program can be back, and we sort of get back to a little bit of normalcy. But again, that's our mantra. If you love them, don't hug them, because somebody is going to go do that and infect somebody inadvertently. We need you guys to work hard on that.
And I think the projections, judging from Memorial Day and the 4th of July, if Labor Day, if we don't tighten up,
Right.
there could
It's gonna
be
be the same
approximately 300 extra cases that we normally would have had, and unfortunately 6 more deaths. So please stay together strong and stay smart and be a part.
Exactly.